Welcome back, registered nurses to be. In this video, I'm going to give you the basics about what exactly you need to say and do in order to ace your clinical nursing exams. If this sounds like information that you could benefit from, stay tuned. To begin, greet your examiners and introduce yourself and state your purpose. Exchanging pleasantries is a great way to break the ice and to set the stage for a strong and confident presentation. Continue by presenting the patient demographics. Data you would state here includes the patient's initials, their gender, and their psychosocial developmental stage according to Erik Erikson. When you have stated the developmental stage, you will need to use your knowledge of the milestones in each stage to place the patient at one end of the spectrum and explain why you have done so. Your presentation of this data could sound something like this. TJM is a 32-year-old female. According to Erikson, she is at the intimacy versus isolation stage of her psychosocial development. Mrs. TJM is on the favorable end of the spectrum at intimacy, as she has successfully established meaningful relationships with others. She does not express, nor does she display any signs of loneliness or lack of personal connection with others. Continue your presentation with the history of present illness. The data you present here will answer the following questions. What signs and symptoms did the patient experience? When did these signs and symptoms begin? How long do they last? How severe are the signs and symptoms? What caused the patient to seek medical attention? What assessments were done by the healthcare provider? What was the medical diagnosis that was made? For this episode of illness, was the patient admitted to hospital and when? What is the summary of the patient's treatment? You could structure your presentation like this. The patient has a 2-day history of vomiting. The frequency of vomiting increased from 5 episodes per day 2 days ago to 10 episodes per day 1 day ago. She has a 2-day history of anorexia and a 1-day history of lethargy and muscle weakness, which got progressively worse. She decided to come to hospital today because the vomiting had increased and she could not eat, and her urine had changed to a very yellow color as reported by her. In the accident and emergency department, her vital signs were normal except for her blood pressure, which was 100/80 millimeters of mercury. A complete blood count, a urinalysis, and a pregnancy test were done. The complete blood count and urinalysis were normal. The beta-HCG levels indicated that the patient was pregnant. A diagnosis of hyperemesis gravidarum was made, and she was admitted for further management of her symptoms. Her current treatment includes IV hydration with normal saline and 50 milligrams Gravol IM every 6 hours. In the next section of your presentation, discuss the patient's social history. The social history is very important because it can sometimes give you a clue as to the cause of the patient's illness, or it can be used for the purposes of discharge planning. For example, if a patient works in a dusty environment, that datum can help the patient care provider to rule out infectious pneumonia and consider more strongly the possibility of a dust allergy that is presenting with respiratory symptoms. Also, the nurse who is aware of the patient's living environment can provide that patient with the supportive education they need to adapt to their home life with a broken leg. Another very important piece of datum that you will collect from the patient's social history is their religion and denomination, as it will influence how you care for the patient. For example, people from some religions and Christian denominations do not eat pork. Medications such as some insulins, which are derived from pigs, may not be acceptable to these patients, and an alternative would need to be sought. Your presentation of the social history could be structured like this. Mrs. TJM lives with her husband and 7-year-old daughter in a 2-story home with modern conveniences such as indoor plumbing, which provides potable water, and a flush toilet which connects to the national sewer system. The household garbage is collected 3 times per week by the Solid Waste Management Authority, and she receives electricity from the National Power Grid. She is a Christian, but she did not give a specific denomination. She does not drink alcohol, nor does she smoke. Next, you should present data related to the patient's allergies. During your data collection, do not ask only about medication allergies. Some food allergies, such as a shellfish allergy, have implications for the type of treatment that the patient can receive. Also, some material allergies, such as a latex allergy, will influence the types of materials used in the care of the patient. You should also ask the patient to describe the signs and symptoms they experience when they are exposed to the allergen. The data you present here could sound like this. The patient is allergic to penicillin and reports having generalized rash and throat swelling when she's exposed to it. If your patient has no known allergies, you could say, the patient reports no known allergies. You should move into the past medical and past surgical histories and the family history of illness next. When presenting the past medical history, give an organized report to include previous medical diagnoses, when the diagnoses were made, and how they were treated or how they are being treated in the case of chronic illnesses. Your report on the past surgical history should be organized. Report on previous medical diagnoses, when the diagnoses were made, and how the conditions were surgically managed. Next, give an organized report on illnesses that have a genetic linkage which exist in the patient's family members. It may not be necessary to report on distant cousins, especially if it is an isolated occurrence of the illness. Your presentation of this section could sound like this. 3 years ago, the patient was diagnosed with type 2 diabetes mellitus, which is well managed with 500 milligrams of metformin PO twice daily. 6 years ago, the patient had a fracture to the lower tibia. An open reduction and internal fixation were performed successfully under general anesthesia. The patient's mother has sickle cell anemia. If your patient has no past medical or surgical history and no family history of illnesses, you could report that the patient has no past medical history, no past surgical history, and no family history of illness. You should now move into the patient's medication and drug history. Give an organized report of the patient's use of prescribed medications, over-the-counter medications and supplements, herbal and traditional medicine use, and the patient's history of illicit drug use. These data can influence the types and dosages of medications that the patient can receive and the types of interventions that the patient receives. Here's an example of how you can structure this portion of your presentation. The patient does not report taking any prescribed medication, but she takes 1 gram paracetamol as needed for a headache or other types of pain. She does not use any herbal or traditional medicines, nor does she use illicit drugs. Continue your presentation with a discussion on the patient's lab values and diagnostic tests. Give an organized report on the laboratory tests and diagnostic studies which were done for the patient. Your knowledge of the medical condition and its medical surgical management will help you to do a purposeful search of the docket for the data you will need for this section. If one test was repeated several times over the course of the admission, give a summative report on your interpretation of the tests over time. You should be able to say if the results were normal or abnormal, and you should be able to state what the normal ranges are. Be able to link the laboratory tests to the related body system or systems. Be able to explain the link between the laboratory test and the pathophysiology of the patient's condition. If no lab tests were done, you could use this opportunity to explain what tests might have been appropriate. If the results are pending, use this opportunity to share your thoughts on what you will look out for when the results are posted. Presentation of the data in this section could be structured like this. A troponin I blood test was done. The results show a troponin I level of 40 nanograms per liter, which is above the normal range of 0 to 14 nanograms per liter. When patients suffer myocardial infarction, cardiac muscles become damaged because of a lack of oxygen. Troponin I is a cardiac-specific protein which is released into the blood when there is damage to the cardiac muscle. A repeat of the test was carried out and the results are pending. However, I expect that the levels will remain elevated in the acute phase of the illness, even though the symptoms have subsided. Next in your presentation is a discussion on the patient's current interprofessional management. Give an organized report on the patient's current management by members of the interprofessional healthcare team, which includes, but it's not limited to, the physicians, the physical therapists, the dietitians, and the nurses. When reporting on the medications, include the generic and trade names, the drug classification, the route and the frequency of administration, and the dosage. Give a succinct explanation of the mechanism of action of the drug and relate it to how the drug will help this patient specifically, since one drug may have several uses. State the side effects which are specific to the drug. End by explaining the nursing implications for the drug. The nursing implications are those nursing responsibilities towards a patient receiving the drug. They include monitoring activities, reporting, and educational support. Your presentation may take this format. The patient is being managed with 50 mg morphine IM every 6 hours. Morphine is a narcotic agonist and opiate analgesic. For patients experiencing a myocardial infarction, morphine acts by blocking the transmission of painful stimuli in the central nervous system. Morphine also reduces the myocardial demand for oxygen, thereby decreasing ischemic damage. Side effects of morphine include drowsiness and sedation, decreased blood pressure and orthostatic hypotension, nausea and vomiting. While nursing this patient on morphine, I kept the bed in the lowest possible position to reduce fall injury, which could occur as a result of the patient's drowsiness. I also monitored the patient's vital signs, especially the respiratory rate and oxygen saturation. This is because respiratory depression is a symptom of overdose, which can be detected early by close monitoring of the patient's respiratory status. I encourage the patient to sit up in bed first and dangle her feet over the edge of the bed prior to ambulation. This was to reduce the risk of a fall should the patient experience orthostatic hypotension. The next segment of your presentation will include a detailed discussion of how you used the nursing process to provide care for your patient. Begin with your assessment data. Your physical assessment should be organized and complete. You should demonstrate that you have used the appropriate techniques in the appropriate sequence to elicit your assessment data. For example, when reporting on your assessment of the respiratory system, you should report your inspection data, followed by palpation data, followed by percussion, then auscultation. On each clinical placement, practice your physical assessment and history-taking skills so that on the day of the examination, you'll be able to complete this phase of the nursing process with confidence and ease. You should discuss the patient's needs and nursing diagnostic statements next. Present the full plan for one diagnosis at a time. Identify the patient's priority needs before you present the related nursing diagnosis. Do not confuse the need, which comes from Maslow's hierarchy, with the diagnosis domain, which comes from NANDA. Ensure that your nursing diagnostic statements are complete. Your actual diagnoses should have the diagnostic label, the etiology, and the manifestations. The manifestations are those data you would have clustered from your assessment, which cued you into the presence of the problem. The risk diagnoses should have the diagnostic label, as evidenced by the risk factors. In another video, we'll discuss the nursing diagnostic statements in detail and how to write a complete and correct statement. If you cannot formulate a nursing diagnosis, it means that your assessment is inadequate and/or incomplete. When you have completed your presentation of the diagnostic statement, move to the outcome statement. Present the complete outcome statement, which should be SMART. Your outcome statement should have a subject, the desired behavior, the condition, and performance criteria. The following template can be useful to ensure that you have all the components. After blank time of nursing and collaborative care, the patient will blank as evidenced by blank. In another video, we will discuss how to write a correctly formulated and SMART outcome statement in greater detail. Next, report on the interventions that you have carried out and those that you have planned but have not yet completed. Your interventions should target the etiology in the diagnosis. Your evidence-based rationale should concisely explain how the interventions you carried out or plan to carry out will address the etiology in the diagnostic statement. Last, present the evaluation statement. Since the presentation of the patient will come at the end of the examination, you should be in a position to present the evaluation statement. Remember to include the summative statement, which is whether the goal was met or not met or partially met. Next, state the full evaluation statement. Since you carried out the reassessment of the patient prior to writing the evaluation statement, the evaluation statement should be written in the past tense. After you have completed your presentation of the nursing management, move into a discussion on the legal and ethical considerations. In this section, explain the legal and ethical principle or principles you maintained while carrying out care for the patient. You should be able to state how the actions you carried out or how the actions you refrained from carrying out assisted you to maintain the name principle or principles. You could structure your presentation of this information in the following way. While caring for Mrs. TJM, I maintained the ethical principle of autonomy. Autonomy means the patient has the right to self-determination. I maintained this principle by respecting the patient requests and preferences for care and implemented them where possible. I did not force my desires upon her. End your presentation of the patient by identifying health education gaps and give an overview of the health promotion activities you carried out in response to these gaps. For example, the patient was unable to read and interpret the nutritional labels on food packages. I conducted a 15-minute teaching session explaining how to read and interpret the nutritional labels. I also directed her to video resources which provide additional explanations and examples. At this point, you would have completed the presentation. End by confidently inviting your examiners to ask clarifying questions. I'm confident, though, that if you follow the guidelines I've just given, there will be no need for additional questions. And that, ladies and gentlemen, is how you get an A in your clinical nursing exam. Remember, if there are additional course-specific information that you're required to present, please ensure that you do so. The information in this video is general and can be applied to all nursing care courses in which a patient presentation is required. Thanks for watching and catch me in the next one.